He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
Hey, welcome back, everyone. It's the Stay Off My Operating Table podcast with Dr. Philip Ovadia. And Phil, the hits just keep on coming. One great guest after another. I did a little research on our next guest, and what I saw and read kind of blew my mind. I cannot wait to hear more. So, set the table for us. Tell us who we're going to talk to.
Will do, and I'm excited for this conversation as well. Today we have Dr. Christian Issels, and really excited to talk about some of the innovative and I guess you could call it alternative, but I'm just going to call it a different approach around cancer that Dr. Issels has been, participating in and promoting for a long time now. So excited for this conversation. Before we kind of get into that, Dr. Issels, why don't you go ahead and kind of give your background and introduce yourself to our audience?
Well, hi, my name is Dr. Christian Issels. I've been treating cancer patients almost all my whole life. I learned it from my father originally. And he came and, explained this whole concept of immunotherapy to me in 1968, 69. I've been around it, Sunday morning walks, every single Sunday he discussed his therapy. So I was just around it all my life. And what he told me was that if you really want to treat cancer properly or any type of chronic disease, you should not really be an MD, you should be more like a naturopath because it's more a standard of care. So the idea is not to be limited by, what I call the flowchart medicine, where you basically have to have a certain treatment for a certain disease process. And it doesn't really look into why people have it. But as a naturopath, we are taught to, look at all things. We are taught to look at the cause and look into, how to best treat that cause and how we can eliminate that cause. And so it gives you a lot more variety of approaches to the same problem. Basically it's not symptomatic. It's basically symptom plus the why behind it. And that's how, that's how we approached, he approached cancer and, and it's how you approach any type of chronic disease. In his mind, cancer is a chronic disease. And to really treat it, you have to treat the causes. Otherwise it's, going to progress until you pass away.
Okay. So why did your father have that particular insight? What was going on with him?
Well, it's interesting. He was from Germany, and he graduated medical school in 1929, and then he got stuck in the war, was at the front line, and saw a lot of things in wartime. But then when he left school, when he left the war, and he opened up his own private practice, he realized that all the people with the major disease processes, like rheumatoid arthritis, lupus, things like that, anything he was used the textbook to treat them with, it did not work. And he said, this is really frustrating. I've been taught this in school and nothing works. So why is that? So he did some research and looked into the old doctors. He called them the farm doctors, basically the doctors who worked on farms, small towns, and they had great results. So he went to them and learned what they did. And he, once he applied their principles, he started having great results. And then, after being really successful in Germany in 1949, one of his patients' wife had breast cancer. And, said, why, why do you treat my wife? Well, I can't, I'm not an oncologist. I don't know anything about cancer. And he said, please try it. So he tried what he did on other patients, like with lupus, and she got better somewhat. I mean, she passed away, but she improved for a period of time. And he said, that's very interesting. Why is, if cancer is just a disease of the locale, like he used to say it back then, that should not work. That should not be something that would be workable, but it improved. I mean, she didn't survive. But he said, this is actually that process of the whole body approach. You're working on the immune system and how the organ system function. Actually worked on her somewhat. And he just explored that more and more and more and came with different protocols, like the dental issue, root fossa infections, lifestyle, psychology, and things like that. And then, then working on the immune system and developing, antigenic therapy from mice with TB. And he injected that. That worked really well. I mean, he used everything. Well, they had mice had TB. And then there's a doctor called Dr. Gerlach. And he used antigens from mice with TB to inject into cancer patients to activate the immune system. Oh. And that they had a really good response to that. Nothing across the board, but there's a response in some cases. Then, I'm sure you heard of Coley's toxin, right? Dr. Coley's toxin. Basically, it's two types of bacteria, which they grow in the bile, kill them off, and then we inject this dead bacteria coating into the body for fever response. And it has shown to be very effective with sarcomas. And he used that as well with other cancer patients. So he did he looked at the whole body, say, okay, we have a body here. Usually when you're healthy, there's no issue with body system function. So the problem is when you get sick, there's a dysfunction between the organ systems. So if you just treat the symptom, you're not going to address the dysfunction of the organ system. So you treat that part of it, but again, other things will fall apart. So the question is why, for example, is the liver not working right? Or why did the lymph system not surveil it properly? Things like that. And then you use different approaches to actually what he called, if there's a disease process, there's also what's called a blockade. And the blockade is something where the information the body provides to the immune system is incomplete or incorrect. And that's why they don't have the response to it. And the way to do this, you have to break the blockade somehow. And one way to do it in his mind was using fever therapy, using some type of, it's not a vaccine per se. Basically, it's just a way to activate the immune system, to introduce something the immune system knows, but has forgotten about. And now you inject that, and then you will suddenly get an immune response. It's the same thing. Have you heard about autochemotherapy?
No.
Well, it's the Germans called Eigenblut therapy. So basically you take about 0.5 or 0.6 cc's of blood, mix it with sterile water, shake it up, and re-inject an IM. And that's one way to introduce, pathogens which are found in the blood, or let me rephrase this, antigens found in the bloodstream. Re-inject them into another body part where suddenly the dendritic cells will travel to see, okay, there's an invasion here, because when you inject fluid into a muscle, it stretches the fibers and it causes an immune response. When they travel there, oh, see, these are antigens. Oh yeah, I recognize those. Let's go back and actually look throughout the body, see where we can find them. And that's basically, taking the information your body has about its state of health, applying it, and to see where it goes next. That's the start of immunotherapy. That's basically the concept behind it. It's not just looking at the cell lines. It's not looking at different parts of the immune system. It's basically looking how can we reactivate it properly. Does that make sense?
Just to make sure I understand, the model of dysfunction there is that the body has, for lack of a better word, forgotten how to respond to a particular situation.
Correct.
And the therapy is to, and I realize you covered a lot of different therapies, but the last one, you withdraw.
I can do it, yeah. Draw your own blood, because when you think about this, everything present in your body right now, any disease factor, any antigens are going to be found in the blood, because basically it goes everywhere. So it goes to all the organ system and will absorb and retract some of the antigens present.
And you just take the blood, dilute it, inject it back into a muscle somewhere, like
correct,
the thigh or the butt,
or arm, whatever, where people want to be injected. And you do that as therapy.
This helps. The response you observe is that the immune system seems to kick back into to working order.
Correct. And it does. It's a very rapid treatment for the common cold. It really works if you do it early. If you do a series of 3 shots in early onset of the common cold, you're very likely to knock it out. Nothing is 100%, but the immune system will wake up and will do its job again. It's the immune system. It's not, when people talk about autoimmune disease, it's not the immune system that's not working. It's just unfocused, is unaware. And it comes down to the question, why is it not aware?
Yeah.
And that's where the crux of everything is. Any disease process is a dysfunction of the immune system. Because if you look at history-wise, when you have a patient who comes to see you after they turn 50, They suddenly have a disease process they never had before. So it's not genetic. Something which kept it on the lock and key suddenly stopped doing its job. And then, then the question is, what caused it? Is it a viral thing? Is it a lifestyle issue? Is it EMF? Is it foci infections from the teeth? Is it, electromagnetic? It's usually all the above. There's a threshold point every person has. When they get past that threshold point, they're going to get sick. And each person has a different genetic background, but that threshold is either very, very high or very, very low or in the middle. It depends who you are. Commonly when you hear a lot, when you talk to cancer patients or, they say to you, hey, doc, I've been healthy all my life. I haven't got a cold. I have never had any issues, and now I have cancer. How is that possible? And again, if they had a bad immune system, they would be sick all the time, right? Because the immune system protects you from everything. So it's not the immune system that's failing. I'm sorry, it's not the weak immune system, not the problem. It's just something which is the focus is wrong, or or not paying attention enough.
All right. So that leads to the question.
Excuse me.
Let's get more specific then about your cancer treatment.
Okay.
From what I can see on the website, there's all different folks presenting with all different types of cancers. We've had Dr. Thomas Seyfried on the show, who stated flat out all cancer is basically the same metabolic dysfunction. What can you tell us about how you're treating cancer?
Well, it comes down to we look at the whole system. Okay. When you see a patient with the cancer or any disease, you do an intake where you go, okay, let me get your history. What's been going on? In general, with cancer patients, just again, in general, if you look 5 years back, something happened 5 years ago in their life. It could be a divorce. It could be got really sick, maybe had an injection, maybe they were in a car accident, and something after that, she never quite felt right. Something was off. And then it takes that long for that cancer actually to take hold. Basically, it grows really slowly in the beginning. Because it's only a few cells, and they double and double, and it takes a while for them to grow. So when we look at, all right, how are this patient's system? Is the kidney function properly? Is the liver doing its job? Is it detoxing correctly? Is the lymph system draining properly? Are the teeth healthy? What's the lifestyle like? How do they focus on problems? How much stress have they had? Have they had some type of history of infection? Have they been exposed to Epstein-Barr or the cytomegalovirus? Or have they been exposed to TB? All these things play a role in how the immune system functions. And because each organ system is interconnected via a neural net, so any system goes wrong, that gets translated across the neural net to the other organ systems. So when you pull out a hair cell, every cell in your body knows you pull out a hair cell off your head. It's just aware of it. It just knows that's, the interconnection of the neural net or the field. Once that field falls apart, that's when you have the issue of disease happening. So the idea is you take patients and you make sure that they get from the disease issue to the ease issue again. And the question is, what are the factors? And in cancer, because cancer patients we see in general are very, they have stage 4 disease. They have tried chemotherapy. They have tried radiation. They have tried, toxic immunotherapy, radiation, and they all have failed it. The question is, if you have in general, another thing I'm going to point out, which people don't think about very often, is then in the big picture, there are two types of cancer patients that they exist. It's broad spectrum, it's very like basically you have the patient who has acute cancer. They're the ones that had something major happen in their life. They got the divorce, were in a car accident, and the body just shut down for a period of, 9 months, 12 months. Enough time for the body, just for the cancer to grow. And then that problem resolves itself with time, and they are the ones who respond really well to chemotherapy and radiation and surgery because the underlying factor has resolved itself. So they will have the good outcome with the therapy. So that's why you have the successes in chemotherapy in some cases. But then you have what I call a chronic cancer patient, the one who has issues with the organ system function, which has been going on many, many years. They're the ones who respond somewhat, but 6 months later, it returns. And then they, do more chemo, and then the progression increases quite a bit. And so that's the people you usually normally see in our practice, the ones who are chronic. So, I mean, that's the key thing. When you get diagnosed with cancer, the important thing to realize is, which patient are you? Are you the chronic or are you the acute? If you're acute, chemotherapy will serve you. If you're chronic, it won't. It might buy you a little time. I mean, they did a meta-study where they took 10 years of cancer patients with all type of cancers and looked at the 5-year survival with chemo, and the numbers are dismal. If you put them all together, it's like 2.7% long-term survival with chemotherapy.
Yeah.
So just to kind of step back a moment and talk about the origin of cancer. So, cancer is basically uncontrolled growth. Group of cells start growing without the normal kind of checkpoints, and the growth becomes out of control, essentially. And certainly, when your dad started his career, the prevailing theory, which came out of Germany and Otto Vorberg primarily, was that this was a metabolic problem, that the cells switched their metabolism, which allowed them to have sort of this uncontrolled growth. And, as things progressed, probably, as you were growing up and then you were going into training, and certainly as I went through my medical training, the prevailing theory became it was because of, gene mutations within these cells that allowed them to grow. And that's largely our focus today, is on these genetic mutations. And we've kind of forgotten about the metabolic issue. And thankfully, I think there is a bit of a resurgence in interest in the metabolic theory. But I'd like to kind of hear just your, at a basic level, what is the underlying problem in cancer? Because understanding the underlying problem is usually what leads you to figure out effective treatments.
Correct. So the way I understand it, and the way I look at the problem is that when you use the idea of genetics, it is, it's basically what you're looking into is probably epigenetics, because those mutations have been present once you're born, and it took a certain amount of time for those to be turned on by getting exposure to certain growth factors or, genes which are getting turned off or turned on to cause the cancer to grow. That's a change of environment of the body to allow those factors to, to be there and to do their, to their bidding. So, it is both. It's a genetic disease as well as it is a disease of the metabolism. They're not separate, I don't think, because metabolism controls what genes do, and genes somewhat control what metabolism does as well. So they're intermarried. So the question comes down to what part of that process can be fixed. We know there's a breakdown in metabolism to have cancer grow. And usually it's unchecked inflammation, which causes cancer. Because once you have inflammation, cells lose they're able to control themselves to what they do. And, once you get that point, anything can go wrong. It's like taking your finger, rubbing it on the table. For the first 15 minutes of it, not a big deal. If you do that for 3 hours, you got a hole. Same thing with any type of area we have, inflammation that is present long term. So, so the first step is, number one, is finding out, okay, what's the cause? Why are you getting that inflammation at that system? Why is that system, irritated for that long a period of time? And and then you have to look at the epigenetics, saying, okay, what parts can I control in removing out of my system so they do not turn into cancer cells? And that's why it's important to know your family history as well, because if you have a history of having, there's a family history, for example, having lung cancer, you do have very likely a genetic issue in that part of your gene pool. So the idea is not to turn those, avoid things to turn those factors on. If breast cancer, example, that's very likely you have a problem with estrogen metabolism. Then if you get on top of that, if you have that issue, then you get an exposure to Epstein-Barr, which affects which will cause long-term inflammation, then you have a higher chance of, developing, breast cancer. But again, it's basically, it's everything goes into how the body is functioning. It's all across how the organ systems are interrelating. Are they supported or are they not?
I'm not sure I'm clear on, well, actually, I am sure I'm not clear, that's the more accurate way to say it. When you talk about body systems, so if somebody presents with a particular kind of cancer, is the thesis that whatever system that cancer is in, that's where the weakness is, or does the cancer show up in other systems?
That's the problem. Is it can be the same system, but it can be other systems as well.
Okay.
Because everything is interrelated. That's the difficulty of addressing the whole body. It's not working on one system alone. It's actually working on all the skin, the liver, the kidneys, the GI system. All these systems have to do their proper job to have a healthy body. So one thing my dad told me, which I think is very true, is that a lot of times when people are very, very ill, to start with, you look at their blood and it looks totally fine. It doesn't look like they have a major problem. Then you start treating the problem and suddenly the blood turns, it shows the true picture of what's going on. And which is a really interesting, I've seen many times where you have a patient come in and you start the whole body therapy, and then suddenly you see things come, something come away. Okay, there's actually a liver issue there. The liver enzymes are off. And then you support the liver and they come back and they improve. Or, there's an issue with, with the GI system. They suddenly have a hard time digesting certain foods, which they were totally fine with before. And then you fix that problem, and then at the same time, the body improves in function and the person gets better. The patient gets better. But it's easy to just broad strokes. And, it's not, we do more than just that, but that's that's the idea behind the whole body treatment, that we have to address the whole body. And then for each cancer type, you have to be more specific. And the newest thing we have right now is, we call that cell therapies. I think it's on our website, where we take your autologous T cells, natural killer cells, and dendritic cells. And we take those cells out of your bloodstream, run them through a cell separator, expose them to the antigens that are found in the serum to form an activation, then we culture the cells and re-inject them as a treatment. So those cells then are exposed to the antigens, and they're going to be focused on to where the problem lies, onto the cancer. But also when you have the dendritic cells, they will actually travel back to the B cells, and they will produce some antigens long term. So you do both. You do an immune response, which is current right away, but then also work on the production of antibodies to produce a long-term immune response. But the problem with that is, if you don't change the underlying milieu after a period of time, those cells will go back into hibernation again. So if you just do one part of the treatment, like just doing the cell therapies by itself, it's not going to work long term, because the environment controls what the cells do.
So what are some of the ways then that you're manipulating the environment to, I guess, favor, these actions from these immune cells?
So the way we control the environment is, number one, we look into, like I said, we do a big questionnaire where we look into, how the systems are working. We look into, kidney function, we look into liver function, we look into lymph system, how well it drains, we look into thymus function as well, and see how these systems are working. And that's the first step. Then support those systems. And then find out if there's, for example, if there's a chronic viral infections present, which will affect the immune system. We test for foci infections. If they're there, we have to address those. And then, for example, then of course, lifestyle, diet is important. For example, if you're a type A blood group, you can be vegetarian. If you're an O, it's very hard for you to be be vegetarian, because you have a very difficult time to absorbing plant proteins. So I've seen a lot of cases where with vegetarian breast cancer patients, because they had an issue with detoxification in the liver. If it's a viral, you treat the virus plus the other organ systems. If it's related to foci infections, we let the see if we can address those if they're willing. If there's a root canal on the meridian for, for example, The front teeth meridian correspond to urogenital areas like the prostate, fibula, the ovaries, the uterus, things like that. And usually they have to be addressed. If you go to the back upper teeth, it's usually the breast tissue as well, things like that. And then just use treatments such as high-dose vitamin C. We do use we use hydrogen peroxide, additionally to the cell therapies, hypothermia, ozone, Laetrile. All these have shown to be effective versus some cancers. Nothing works in all cancers. But again, if you start working on the underlying milieu, they will have a good outcome. And the big thing, with people, if you look at all the treatments with, which right now people propose is, looking at the one-shot curing cancer, like the one vaccine or the one therapy to address it all. And I don't think it's too complex to have that happen, because you can take, the same cancer, and you have 10 patients with 10 different reasons why they have it, and you have to treat them differently, each of them. And which makes it very hard to mass produce. There's no really money in treating one patient at a time, because you cannot mass produce in the factories to get the payment for.
Yeah. I want to go back to something you said. After the intake questionnaire, you find out if there's dysfunction in the organ systems, and then you said support the liver, support the kidneys, support the phallus, support the lymph.
Right.
What does that look like?
Well, again,
I'm the layman in the group here, so
right. Okay, so
I'm
what
doing
it would
my
look
best
like,
to stick with you.
Okay, no worries. So what I would, for example, if you look at liver function, we would use the proper what I call cofactors for detoxification. We would use things such as taraxicum, which is dandelion, which increases bile flow, which is one way toxins leave the liver. That'd be one step. If you look at you look at the minerals, the magnesium, the potassium. We use the B vitamins, folic acid, things like that, to make sure we have those proper detox pathways. Make sure they function well, so whatever the liver gets exposed to, it can process it. And then, of course, you need to have the right proteins to conjugate the toxins to expel them through the gut. So so when you do work on the liver and you don't fix the gut, all these toxins will get reabsorbed in the gut to be going back into your bloodstream to cause a vicious cycle. So then you have to work on, okay, how can you make sure your gut is working right? And you have to look at digestive enzymes if they're necessary, proteases, proper, gut flora. They did this study. There's a one-man study which is really interesting, not cancer, but basically the guy had history of, he was morbidly obese, he had history of heart failure, and he was diabetic. And what they did a study in England where they actually, do you know what Olestra is?
I've heard of it, but I don't remember what it's supposed to do.
Basically, there's this great food additive, great thing they did in I think 2000. I think was it 2000? But they said they put it on chips, so you would not, you wouldn't get the fat of the chip. So you can eat your chip, but you won't, get the cholesterol out. That was the idea behind it. What it does is actually a fat that doesn't get absorbed by the body. So basically, you would poop it right out. And that's why they had issues with the Olestra, because people had bad smelling stool and loose stools. So the only thing he did different with his lifestyle was he added 15 Olestra chips 3 times a day for 3 years. That's all he did. And in that time frame, he lost most of his weight. He's no longer diabetic, and he improved his heart function. The reason it worked is proposed that what happens is when you detoxify, and the fats like the bile salts, get reabsorbed in the gut. So if you get rid of the toxins, you put them into the GI system, into the small intestine, large intestine, and they don't get expelled, you're going to get re-exposed to that. So Olestra bound all those toxins, the pesticides and those things, and he pooped them out slowly through the 3 years, and that increases metabolism. And so he lost the weight. Once he lost the weight, it increased. It reduced. His blood sugar, because as being obese causes insulin resistance. But reduce that, and then of course because you have the lack of the like fat, there's a lot of vascular area. And that increases, the stress on the heart. And so all these things work together. but he did it very slowly. I mean, it's a very, it's not a lot of therapy, but it took that long to get the response. So, but again, he had a way to fix the problem. And with cancer, unfortunately, a lot of times it's going to take some time to fix the problem. You don't have 3 years with the cancer patients to really, fix the whole problem. But you can actually fix some of the problem and do treatments which attack the cancer to buy yourself the time to fix the problem. And the average therapy, when my dad did treatment in Germany, I mean, the average treatment time was a year. People were with him for a year. Wow. And that's when you get the great results. If people did it shorter, they didn't respond as well.
So it almost sounds like, I'm trying to figure out how to articulate this question. It sounds like you're treating cancer as simply the single most unavoidably obvious symptom of an underlying health issue.
Correct.
And you're not really treating the cancer. You're making I guess you're approaching it from the standpoint that the cancer, the body will take care of the cancer if everything else is working right. Is that right? Am I?
Yes, correct. It's a little bit more than that, but very close. Basically, if you have a healthy body, the body it's not the environment where cancer can grow, because all the metabolic issues which cancer needs to be present are going to be gone. So suddenly there's no more nurturing the cancer. But the problem with that process is that patients in general don't have the time. And secondly, they have had so many different complex therapies done to them, which is highly toxic, that it's so we need to treat the cancer, and then we use it with, that's why we use the cell therapies. We use therapies that are shown to kill cancer cells without causing side effects per se. I mean, we don't want to go say, well, I know you have a toxic body, and it takes a lot of time to fix that underlying toxic exposure. Now we're going to give them more toxins while we're trying to buy them time. So if that doesn't work, because basically you're not going to reduce the load that you need to control the outcome. So we want to do therapies which are nothing's non-toxic, really. I mean, have no, but the least toxic outcome possible. And that allows the body to respond and actually remove the underlying cause the best as it can. In some cases, you can't get it done because people are not compliant.
Right.
I mean, we can buy them time, but again, if you don't make those changes, which I mentioned, like addressing the system function, because it's not easy to address that. It's not easy to address, if people are really set in their ways. Unfortunately, I mean, people know what they like, and they have, for example, people love the carbohydrates. They, like the cake, they like the candy, and for them to give that up, it's giving up a friend. I mean, basically, you go home, I'm looking forward to having my ice cream after dinner.
Yeah.
Or whatever they take in.
I guess, in a lot of ways, kind of like Jack said, you're not, the focus isn't necessarily on the cancer treatment. It's on sort of more in the environment. You mentioned that, many of your patients before they come to you, have already done, whether traditional, non-traditional, they've done lots of other treatments that they've largely failed. And you're now seeing people who have, failed multiple courses of treatment. I guess, what's the general sort of approach as to whether, the types of therapies that you do and you instruct people on, continuing, let's say, what we'll call more traditional treatment approaches? Do you think these are substitutes? In an ideal world, would you like people to try, kind of these other therapies first, your immunotherapies that you do, before doing the other stuff? How do you think they work together?
Well, again, they do work together pretty well. I think when I talk to patients, when I see patients, they're usually at stage 4 or stage 3, where they don't come to me early. If they come to me stage 1, of course I cannot prove it 100%, but I think I would be almost 100% a cure rate, but I don't get that. So it's really hard for me. I mean, that's what I would do. So basically look at the problem, address the problem, And then, that because then you have the time to really do it. Then you have the people who are, and you get the first stage diagnosis, it's not going to go anywhere at least, 3 to 4 years, to be, or a little bit less, but that's enough time to address the underlying cause. But if they come to me, stage 3, stage 4, and they have a large tumor which is pressing against the, aorta, it's compressing it, and basically I don't have 3 years to do anything. I gotta take something aggressive, like chemoembolism possibly, or radiation or surgery, to help me get the time to actually address the problem. It's a time factor. It's basically, the tumor is not going to stop growing the first day of therapy. The idea is it's going to keep growing until it gets to a point where the therapy starts working and the cancer stops growing. But that could be, a month away. It could be, enough time to progress and actually obstruct, the blood flow, and then that patient is dead. Or if it presses on, if it affects liver function, it shuts down the liver. The therapy is great, but the patient's not going to be alive. So again, you need to know the case. You need to look at where are we, what part, look through the history to see what are the organs that are working, and do I have the time to address it properly? And then the question, if I have the time, then say, we take our time. If you don't, then you go, we do therapies which are, allopathically minded, like radiation, surgery or chemoembolism, things like that. And then to get us the time to get it, and use the therapy which is going to be least toxic to the patient. Systemic chemotherapy is going to be very toxic, but chemoembolism is still going to be somewhat, toxic. It's still going to spread throughout the body, but it's not going to be as aggressive with that. Surgery, again, it's cuttable. Let's cut it out, except sarcomas. Don't touch a sarcoma ever, because it gets more aggressive each time you cut it. So, but again, in general, you can cut it out. The another part in this process, the less tumor the body has to fight, it's going to be easier to overcome it. If it's a lot of large mass, it's going to take more time. If you cut it out and you suddenly have only a few cells floating around, it's going to be a little bit easier for the immune system to do its job. But the key thing is it has to stay active long term. It cannot just turn on for 6 weeks, 7 weeks, 2 months, and then go back to hibernation again. Excuse me.
So is the distinction, I'm sorry, Phil, is the distinction between what you called acute cancer and chronic cancer, is that you're really talking, as it sounds to me like you're really talking about the underlying wellness of the patient otherwise, and the amount of time that they've been in a fundamentally diseased state that may or may not have been presenting with any symptoms.
Correct.
They're not really two different things. It's just
that's basically, it's a chronic person with chronic disease, except the first symptom of the chronic disease is the cancer. Right.
Okay.
That's the main principle behind it. Basically, you have a body that is kind of like having, it's like a field of weeds. You got the roots everywhere, except the weed has not, germinated yet, but it's there.
Right.
So the idea is you cut through surgery, and you cut the top off, but not the weed, not the roots. The same thing with using chemotherapy. It's like using weed killer, but even it works most of the time. You're still gonna have some weeds come back because the soil is still allowing the weed to grow. That's the kind of the concept behind it. So you want to make sure that soil is not hospitable to the cancer. It cannot grow in that environment. And that's where Otto Vorberg comes in with his metabolic issues. The environment controls what the cell does.
This would be, I think, for those of us who are not medical professionals, I've heard the name Otto Vorberg many, many times, but I'm not that familiar with his work. So give us a quick history. What was his contribution to the field?
Well, basically, what my take from that was that the metabolism, that everything which the cancer is a cell that lives on, it's anaerobic. So in a sense, oxygen is anti-cancer per se. So basically, everything which anaerobic, metabolism will produce cancer down the line as long as it stays anaerobic. And that's just the main idea he took away. Basically, if you have oxygen present, it does not cause cancer. But if you are living in an environment which is lack of oxygen, anaerobic, that will develop a disease process. That's the main principle he brought back. And I think that's a very important one too. Because basically, anytime you think about, I mean, just think about exercise. When you use your muscles, you run, and after a period of time, you run out of oxygen, and then you start working on, anorexically, basically, and then you produce lactic acid, and that's an irritant. Same type of concept with, with the fear Warburg was talking about. It's much more complex than that, but basically, that's the principle behind it. Anything anaerobic will cause inflammation, and if the inflammation is there long enough, it will cause a mutation in the cell, and it will become what he called cancerous.
And, one of the other, I guess, key parts of Warburg's theories was that, cancer cells live off of glucose, and that they will basically, they're going to find a way to get glucose. They're going to steal it, take it from anywhere. And, to the point that, I guess, to an excessive point, that they are going to go to, essentially start to cannibalize the rest of the body to be able to get the energy that they need to survive.
Wow.
Yeah, and that's it's interesting when you look at PET scans, and you look at those. I mean, the most hottest spot in the body are the cancer cells, and it's how they determine that cancer present because the metabolism is so efficient in absorbing glucose. But the metabolism, of course, is going to be anaerobic and cause the buildup of lactic acid, things like that.
Right.
So it sounds like the folks who show up at your clinic are, as a rule, are well past the point where they could have made a change earlier that would have prevented them from getting to that point.
Correct.
So I'm guessing that you have some guidelines to prevent people from getting to that point.
Correct. I mean, the biggest thing I think I can mention is stress, metabolic stress, as well as physical stress. And I mean, basically, what stress does, as it causes, it doesn't allow you to actually heal. There's no healing response to stress. And it also, there's no real, you don't absorb when you're highly stressed. So basically, number one, you won't heal yourself, or you will not absorb as well when you're stressed. So, and that alone being in that stress factor for a period of 5, 6, 10 years, it's going to cause you depletion in your nutrition already. Basically, you're just not as efficient in absorbing because you're stressed. And then, of course, having, exposures, having dental work done, which is improper, having root canals done, which are quite dangerous. Dental hygiene is important. Of course, eating organic foods is important. Things like that. Make sure you have, a good intake of vitamin C. Have a good multivitamin to take in, but make sure you absorb it too. A lot of people say, yeah, I've been taking vitamins all my life, and it doesn't really work for me. They don't do much for probably you're not absorbing the vitamins. A good digestive tract, so improved digestion. But when you get older, your digestive tract reduces in function. So basically, you're going to support. You got to do the hydrochloric acid if you need it, and digestive enzymes. Then again, using fish oils are important because they keep the membranes healthy. Because everything your body does, it you secrete or absorb, it goes through membranes. So you have to have healthy membranes, things like that. Make sure that the organs, make sure you support the liver. You don't do anything that's really damaging to the liver. A key thing I want to mention for women: don't take any milk thistle. Milk thistle is, for women. Men is fine, but women have a hard time with milk thistle. It's something you can be really careful with. They'll usually overdose, and it causes liver stress, even though it's a liver support. But if you do too much of it, it's going to do damage. Let's see.
Interesting.
Yeah, people don't know about that. But again, another part is if you're a type O blood group, you do need animal proteins. You can be vegetarian. Another part is, you think you live a healthy lifestyle by eating a lot of fish, but a lot of the fish, as you know, has mercury in them. And one of the worst ones to take in is actually red snapper. They have the highest mercury level of the fish. Tuna, of course, tuna, swordfish, all these ones, you can buy them in a store. They can, they have a couple of companies. I'm not sure if it's still business now, but they actually test the fish and they make it, they say it's mercury free. So it's, it's a good quality fish. Eat organic, make sure it's if you eat meat, it's free range, things like that.
So you're describing stress in a much broader, using a much broader definition of stress than folks are typically used to thinking of. We're not talking just about emotional stress or mental stress. We're also talking about physiological stress that you place on your body through what you eat, obviously, but I guess all the other factors as well.
Well, one of the stresses people don't really think about is carbohydrate intake. Unopposed carbohydrate intake is a high stress on your body. I mean, for example, you eat a banana. You chop the banana, you swallow the banana, it goes into your stomach, into your small intestine, it gets absorbed, your blood sugar spikes. Then the insulin gets produced to reduce the sugar. Suddenly the sugar drops. And everybody says, oh my God, my sugar is low. Then he tells the adrenals to produce cortisol, to travel to the liver to produce more glucose. And that's when people have that, that postprandial coma. When they come home, they take up a lunch and they go back and say, oh, I'm so tired. I mean, that's what that is. That's that, stress factor. And people do that 4 or 5, 3-4 times a day. And that's as bad as, running from the tiger. And they do it via diet. So food, foods, for example, should be combined properly. Anytime you eat any type of carbohydrate, combine them with some fat or some protein, or both. Excuse me. So yeah, it's, the stress is, it can be EMF stress as well. Watching TV, or having a phone next to your bed. Anything that's not normal function for your body can cause some type of stress for you. So you gotta be, but right now in the world we live in, you cannot avoid it really. You cannot avoid Wi-Fi. How do you, excuse me, I've been swallowed. So
yeah, we live in a world where we've got all kinds of radio waves going all
right, and that's why there's been more cancer. Or faces more chronic diseases.
I don't even know which direction to take the questions, Phil. It's kind of, it opens it up.
I hope I made sense.
Talk about that relationship some between, these other chronic diseases and cancer.
Example, there's a, excuse me. For example, people with TB, there's a high, because chronic TB, people will develop lung cancer down the line. Because of the, irritation. For example, lupus is an autoimmune disease, which, excuse me, I'm going to tickle my throat, I do apologize. So again, these functions they only cause irritation down the line. I mean, the unchecked irritation is the problem. Because it causes inflammation. If you have it long enough, there will be a weakness. And
yeah, I think we see over and over, all these various, disease processes that we talk about. For me, obviously, it's largely focused on cardiovascular disease. You're talking about cancer, whether we're talking about diabetes, Alzheimer's disease, all of these things point back to inflammation and this chronic, inflammatory response to something. And those are usually, some external stimuli like the food you're eating, or, stress, like you mentioned, and lots of other things that can be leading to this inflammation. And then when that gets kind of out of control, that's when we start seeing problems with these chronic diseases.
Correct. Yeah. If you look at the approach of, if you look at cancer as a chronic disease, the approach is going to be different than having, the disease of, the locale. And you look at, you develop a breast lesion. What are you going to do first? If they can cut it, they will cut it. Next thing, they're going to radiate it, and then say, go home. You're cured now. Let's, do some testing. And if it comes back, we're going to either radiate again or do chemotherapy. But they don't even think, okay, why is it there?
Yeah.
I think this has really been a, kind of fascinating discussion around cancer. I hope this is going to stimulate some people to think differently about this, and, leads us down some different ideas about what we might do to effectively manage this disease process. So let people know how they can learn, get in touch with you, learn more about your process, where you treat patients. I'm sure, many people are going to be curious about this.
Yeah.
So they can, right now, we have a center in Mexico, in Tijuana, where we do the cell therapies right now. And the way to find us is, the website is, Issels.com. And the phone number is 805-500-8349. And I'm also on Twitter, Dr. Issels. Can you put that on information down possibly? The Twitter.
This will all be, I'm looking on the website, and this information is in fact there on the website as well. Phone number, email, there's your Twitter. Yep. So we will make sure that all this information shows up in the show notes.
And the way we usually do this, we have people call us, and we will respond, and then we send them a first email, a place where they can download their information. And I review that and say, well, yes, you're a candidate. No, you're not. And then the next step is if they want to proceed. And it's pretty much, a little bit about the program. It's a 12-day program in a 6 months home care protocol afterwards. So basically, the first part of the process is where we do the cell therapies first. And so we have that activation of the immune system right away. And we use T cells, natural killer cells, and dendritic cells in that process, which are activated, re-injected, and then you go home. And then we do the long-term workup for the underlying causes. This is, in average, going to take 6 months.
Wow. Well, I would encourage listeners to go to Dr. Issels' website, Issels.com. That's ISSELS. Again, the link will be in the show notes. Just read some of the stories. I was fascinated to find story after story after story of folks who'd basically been given no hope at all by the allopathic approach to cancer treatment, who are alive today because they attribute it to Dr. Issels' treatment. So I suspect this episode is going to save some lives. Absolutely.
I hope so. Thank you so much for having me.
Wow. All right. Well, I don't know how you top this one, Phil. This has been the Stay Off My Operating Table podcast for Dr. Christian Issels and Dr. Philip Ovadia. I'm Jack Heald. We'll talk to you next time.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.